Hi guys, welcome to my channel. I'm having a little hard time adjusting. Alright, so I am exhausted, but we have to go through a few more items before I can get ready to, do other stuff. If y'all can tell, I'm getting tired. But anyway, let's talk about the spine. So far, we've talked about the brain. We've talked about what could go wrong with the brain. We've talked about degenerative conditions of the brain. We've talked about immune problems with the brain. We've talked about how to fix them. We've talked about surgeries when it comes to the brain. We've talked about increased intracranial pressure. So now we're going to talk about the spine, because you cannot do neuro without talking about the spine. Now, these are like physical things that could happen to your spine, right? So, one of the things that can happen to your spine is called a spinal shock. Like, let's say you got into an accident or whatever, you had a spinal shock. So what will happen is there will be weakness below the level of the injury. Let's say you have it at T3. Weakness will happen. Is it weakness? Yeah, weakness below the level of injury. That's all I know about that. Maybe I need to look more into that, but that's all I know. The other thing you could have is neurogenic shock. And with neurogenic shock, it happens usually with patients who have had injury above T6. Wow, I'm surprised I didn't write that down. That's crazy. If you had, I think that's more for autonomic dysreflexia. But neurogenic shock, it has to do with if you've had trauma to your spine. There's this little inflammatory things that kind of rushes through your vascular system, causing your blood to just kind of stay. It causes your blood vessels to vasodilate, and your blood kind of just stays in your peripheral, not doing anything, which will cause your core to be very cool and whatever, and then your peripheral area is going to be warm and dry. With this, we'll see hypotension due to the blood is not flowing, it's not being pumped, it's not going back to the heart. We'll see hypotension, bradycardia. What else? Yeah, I already talked about all the other stuff, and we'll treat this with vasopressors. So that is neurogenic shock. Obviously, you can have a tetraplegic patient or a quadriplegic patient, which is what I gotta look into. And the other complication that might happen is autonomic dysreflexia. This happens when there's injury above T6, thoracic 6. That's most common. It happens after you've had the injury. So with this, you want to always make sure that the bladder is not distended or the bowel is not distended, because this is what really causes this problem, or any sort of stimulation or stress. But the signs and symptoms we'll see with autonomic dysreflexia is hypertension. We'll see congestion, like nasal congestion, bradycardia. We'll see pounding headache. I'm thinking the hypertension causing a pounding headache, and profuse diaphoresis, autonomic symptoms. Okay. Yeah. And what I read is from T12 you can have respiratory problems. So trauma to the spine, there's risk factor for respiratory problems. There's risk factor for autonomic dysreflexia, neurogenic shock, spinal shock. What else can happen? Urinary retention causing a lot of UTIs. I guess I gotta do more. Urinary retention, which can cause UTI, which can lead to some other complications we talked about kidney issues recently, right? So we really want to take care of urinary retention as ASAP. A complication could also be sexual dysfunction. Again, the nerves that happen below, in your spine, might not be able to innervate your penis and cause an erection. It might also cause respiratory complications, and skin integrity might be implicated with this condition. Obviously, because the patient might be sitting on their sacrum all day, which might lead to or cause pressure ulcers. So it's important to have the patient sit up from time to time. Not only does it prevent the complication of blood clots, which I did, which not only does it prevent blood clots, but it will also help with blood flow. It will help preventing contractures, which is another complication that I didn't write. Wow, I feel like I need my pen with me. Yeah, so things. Oh, I'm tired, yo. That's how you know you're tired. I need to go to bed. Okay, I think it's time for me to go to bed, guys. But anyway, if you have a problem with the spine, the most important thing to do is to immobilize the patient. You want to have them like log roll them, like not fold them, like log roll them. Put a cervical I can't say that word, cervical collar on, or a rotor rest bed to kind of move the bed, like, or you could also put them on the hollow system cervical thing, like from here all the way to here. So that is it that I have really for the spine. I hope I covered a lot of it. Like I said, it seems like as I was going, I started thinking of a lot more things that could go wrong, like contractures, lack of movement, constipation. Do I have that in here? I don't even have that here. That's crazy. So yeah, constipation, contractures, blood clots. What else could happen? Skin integrity issues like pressure ulcers. What other thing could go wrong? Like UTIs, which might then lead to. Okay, when it comes to UTI, let me think about this. Yeah, if it's a viral infection, which I doubt, usually UTIs are bacterial, it can go in and cause glomerulonephritis. Yeah, and from what we learned like a long time ago, or what I learned a long time ago, backflow of blood causing, I don't know, something. Pyelonephritis or something like that, I don't know. Okay, so that is this for this video. I think I'm gonna end it now. I think I'm tired. I'm gonna go get ready for bed. It's 2 a.m. Hopefully I still end up waking up early to make the video. I think tomorrow I'll focus on psych. I'll talk about personality disorders, cluster A, B, C. Oh, we have something to do today. I forgot. Cluster A. I forgot. Cluster A, B, C. What else? Cluster A, B, C. I'll talk about IDDs, which are developmental disabilities, or intelligence, things like that. Talk about eating disorders, and actually focus on putting the meds together. I think my focus for tomorrow will be just putting the meds together, because my meds are not on point and I can feel it and I can sense it. But anyway, thanks for watching my video. I am tired. You can tell I'm rambling on this video. Not professional. Thank you. Bye. I feel drunk. Good night. Good morning.